Yes, Rafikan, please introduce yourself.
Greetings, good colleagues. I'm not from an NGO, so please excuse me. Yes. My name is Rasigan Miraj. I run the Institute for Economic Research on Innovation, which is part of Tshwane University of Technology. So we're particularly interested in the advert, your byline about science and technology in Africa, and that's what we're looking forward to. Best wishes. Thanks.
Yeah, thanks a lot, Rasika. Nice to meet you. It's great that you expressed interest in this. I'm sure Ayman's content is going to satisfy your curiosity. So I'll just go ahead and just speak lightly about the African Alliance. So the African Alliance, basically, just in terms of a short introduction, the African Alliance is an organization that started primarily as a consultancy in 2013, dealing a lot with HIV-related issues. But constantly and gradually it evolved in 2020 upon the pandemic ravaging the entire world. It evolved into a specific COVID-19 related intervention, where the work was to gather community, CSOs, as well as other nonprofits who are interested in. Hi, Tulisile. Hi, Christine. Nice to see you. Yeah, I was just giving a short introduction to the African Alliance. So gradually it evolved to provide COVID intervention. This actually involved being part of the People's Vaccine Alliance. So that the African Alliance became the home of the People's Vaccine Alliance Africa, which is PVA Africa, which we are now known as. And the work of PVA Africa essentially is to enhance pandemic preparedness and vaccine equality, as well as health justice across the continent. So what we do is, together with implementing partners, we identify organizations that work with communities and equip them and support them in terms of the deliverables that they suggest in their proposals. So we accept proposals. Currently, we have 5 sub-grantees, and Ayman's EAPR is part of them. So that's just one wing of what we do. Another major wing of what we do is a lot of advocacy when it comes to health justice, especially in Africa, but largely over the global south. So what we do in this sense is we conduct research as well as disseminate information related to COVID-19. And right now we've evolved into more of pandemic preparedness. So rather than just focusing on COVID-19, we're focusing on just how African countries and African organizations can be prepared in the event that another pandemic ravages the world. So that's our current focus at the moment. We are deep in the process of finalizing our strategy, which will be launched in July. And this is something that we look forward to still engaging the rest of our African CSO partners in this exercise, just to know that if the areas that we have narrowed in on, based on our co-creation process, are the areas which are most vital and need intervention across the continent in regards to health justice and vaccine equity. So that's just a short brief of the People's Vaccine Alliance Africa. Aside from that, we also have about 100 members, and that's mostly thanks to Takudzwa. So we engage our members through such forums, the Civil Society Organization Forum, which we have every month. It's usually on the last Wednesday of every month. Of course, yesterday being Eid, we decided to push it to Thursday, but we're happy to have you. The specific focus of this session is to celebrate the Day of Africa's Scientific Renaissance. So this was an initiative that was started by the African Union in the 1980s. Basically, there was a lot of conversation then about Africa's lack of contribution or minimal contribution to healthcare interventions and healthcare solutions, not only for ourselves, but for our world. But the African Union decided to celebrate this day, just to set aside this day to celebrate Africa's progress in terms of health interventions, in terms of scientific research interventions. How has Africa contributed to the rest of the world when it comes to scientific and research innovations? So that's the premise of why we are here today. And the reason why we selected Ayman for this specific process is because he's doing an amazing job with EIPR in terms of fusing research, science, technology, and impacting the community, translating all the data and information that is discovered through the work of EIPR and finding relevant ways of benefiting the communities and achieving impact that he set out to alongside his colleagues at EIPR. So I think that's enough about PVA Africa, the Africa Alliance, and I'm sure Ayman can do more justice to EIPR than I've done. So Ayman, feel free to go ahead.
Sure. Thank you very much, everyone, and thank you for this great podium to tell you more about our work. And I was very interested, and I went on exploring a little bit the notion of Africa's scientific day of Renaissance, and Day of Africa Scientific Renaissance, to be precise. And I think that within this context, it was very interesting to see how different kinds of innovation, different kinds of scientific and societal interventions can originate from Africa and really be exported to the rest of the world. And I think this is really the epitome of what Africa can provide to the global society. And so in my presentation, I will be trying to shed the light on some of the interventions that we've been carrying out in the last maybe in the last 4 years, more or less, in the context of health. So covering different sorts of social innovation, different kind of community-led interventions, and how pushing this forward can actually make it better and make the realization of the right to health for people around the world happen in a way that is more sustained, more less discriminatory, and more resilient to challenges such as COVID or inflation or these sort of things. So first, let me give you some context about my background and what I do, and why I end up doing this kind of work. And I'm going to ask Martie actually to let me know when I'm only having like 3 minutes left, just to make sure that I am that the time is going right. Perfect. So I'm originally a medical doctor. I graduated from Cairo University Medical School in 2008, and then I joined the Egyptian Initiative for Personal Rights as a right to health researcher. This is the leading human rights organization in Egypt that's been working for more than 20 years on different rights, including socioeconomic rights, access to justice, rights of people with specific vulnerabilities, or people who are deliberately discriminated against. And this is in a context of Egypt where advocacy and work on human rights issue can be quite dangerous and risky. And it was really up to us at this stage to figure out the area of work within the context of the right to health where the work of EIPR can continue within this context. And so adopting a right to health-based approach was really critical in the kind of interventions we carried out. And based on this, we realized that in addition to being a human rights organization, we have to have strong links and ties with community organizations who can take the lead in terms of our field work, in terms of our community interventions, and function in a way that can relatively be more accepted by the government, and so be able to have these encounters, these meetings, these conversations with government officials without necessarily having the same risk as a human rights organization. And this is when the partnership with Shamsiyya happened. So Shamsiyya is a social enterprise. It functions as a non-for-profit consultancy, which means that it provides consultancies for development agencies, private sector, public sector, but it also has its own set of projects, social projects and research and advocacy interventions around health and access to universal healthcare coverage, and this is all in a context of a nonprofit. So it has the freedoms of a company. It pays taxes, but in the same hand, in the same way, it doesn't have shareholders who expect dividends and returns on investment, and so it has the capacity to reinvest its own revenues into the social ventures and the social projects that it carries out. So the approach of Shamsiyya is that it's basically a team of problem solvers. Their job is to research different challenges facing the healthcare sector and to devise solutions for these sorts of challenges. Now, when we're talking about solution design, we're particularly focusing on people-centered solutions because this comes from a continuous and inherent belief that people are experts in their own needs, in their own matters, in their own circumstances. Every single person, regardless of their income, their education, where they live or what they do, every single person is an expert in what matters the most to him and his family or her and his family. And so it's important to be able to listen to them and to devise solutions based on this. So the role of Shamsiyya is to give patients voice, to collect their feedback, and to feed that into the recommendations and works that support decision makers, that improves healthcare quality, healthcare service quality provision, and that makes healthcare management more sustainable and more efficient. And I'm going to shed the light on 3 of the interventions that employ technology, social innovation, and community-led action to put this in action. So the first of them is eghospitals.com, which is a community-led monitoring tool for the quality of services provided in hospitals in Egypt. The way this works is that we have a number of local community members of local civil societies who we partner with. We train them on a community monitoring tool, which we call a mystery patient monitoring tool, and they go on a planned set of intervention to carry out community assessment of hospitals based on a set of indicators and measures that reflect patient experience. And they do this as mystery patients. So sometimes they are the actual patients, sometimes they are the accompanying people to actual patients, and they have different models and scenarios for that. Think of it as the reviewer for restaurants or for hotels, who goes there incognito, experiences the services, and rates it while doing that. Throughout the work of VG Hospitals, we have managed to carry out community assessments of over 600 hospitals across the country through partnerships with 57 local NGOs. And we have resorted in this to over 250 community members who are mostly youth and mostly women. And right now, the website EG Hospitals is the primary source of information about 65% of hospitals in Egypt, because it has on it ratings of the quality of services, and it gives us access to data about the performance of each of these hospitals, which we can then present to decision makers, to the Minister of Health, to the Minister of Finance, to parliaments, to decision makers overall, in order to make the needed changes for the way healthcare system functions based on data that is driven from communities. And of course, in the end, this is put on a public website, which gives access to this kind of information to the general public. This also allows us to monitor improvement processes in different reform efforts. So for example, Egypt right now is undergoing the implementation of a universal healthcare coverage scheme. So we managed to carry out a community assessment of hospitals before the implementation of the new law, and then after the implementation of the new law, giving public officials access to data about the improvement and what happened in there. We then took this model and implemented it in a more youth-centered way in Tunisia, which allowed us to carry out a community assessment of all of healthcare services in a specific area, which is Tatawin. And then we implemented what we call a youth-friendly services project, which is focusing on services presented to youth. And then this was displayed on a dedicated website that shows places that provide youth-centered, youth-friendly services in Tunisia. And then finally, in Egypt, we implemented this around services provided to women. And then we developed this project, and this is like the second example of social innovation and use of technology, which is called Nasah. So to explain Nasah a little bit, and sorry for the Arabic, I'm just using, you know, the visuals that we use to explain things, generally speaking, to people in the country. So in Nasah, it works a bit like the GPS to the healthcare system. And let me tell you why this is important. In Egypt, we have a number of laws that provide health insurance coverage to different sorts of populations. So we have, you know, a number of laws that covers in the end, in theory, over 50% of the population by health insurance. And it is estimated in Egypt that we have over 58% of people insured by the National Insurance Board. Now, when we look at the utilization rates of these services, the situation is distinctly different. 92% women who are eligible to insurance benefit from services. And when we look at the different demographics, in total, we have 20% only of those insured actually ending up using these services. And from the poorest quintile, only 14% actually end up using these services. And the reasons behind this revolve around the services being not known. Many people don't even know that they are insured or that they are covered, or they get lost in the bureaucratic process. They get lost in the paperwork that, you know, entails their access to these sort of services. And so what this project does is that it provides some sort of a navigation system for patients using WhatsApp, using Facebook, using the phone calls. We assign agents to each patient who are in need of a surgery or chronic medication or to undergo any intervention. And they are then provided with support to be able to access the service that they need. This is also provided to those who do not benefit from insurance, but who have access to different kinds of insurance or to different kinds of healthcare coverage provided by the state as well. And this was really very important, especially during COVID, which brings me to the third and last example of our social interventions during this time related to COVID. So during COVID, we, first of all, we made a version of our community monitoring tool for hospitals, eghospitals.com, which I just explained, and we turned it into a tool for monitoring of the extent to which public spaces respect safety and hygiene measures related to COVID. And so the idea behind this is that through a community assessment process, people can go to public spaces and carry out these assessments, which are then published on a dedicated website, letting people know which places are providing safer services and which people respect them. And then finally, the last example of things that we did during COVID as well was that we needed to know how people were responding to the different measures and regulations provided by the government in respect to COVID and COVID prevention. So in order to do that, we devised a research process which is based on 100 Egyptians. Okay, so this means, what is written here means 100 Egyptians. And what we did is that we selected a cohort of 100 people from Egypt, covering different demographic, different age groups, different living areas. And we made a deliberate effort to make sure that representation is at its maximum from these 100 people. This cohort of 100 people were being asked regular questions, either on a daily basis, on a weekly basis, or upon need, to ask them specific questions about how they actually behaved following different government regulations and mandates. So for example, the government would say, there's a curfew, for example, starting from 6 p.m. We would ask people, are you respecting this curfew? The government, for example, would ban access to specific public modes of transportation during a specific period of time. We would ask people, are you respecting this? How do you go along? Do you go to work? Did your income get affected? And these sort of things. And we would ask these questions, collect them, and then publish these results on a regular basis to give an idea of how communities were reacting to these regulations. And we would be using, different statistical methods while being aware of the fact that this is a sample of only 100 people, which are not necessarily representing the entire Egyptian population. And we're aware of this. And we always say this sample represents itself, but it gives an idea to the kind of attitudes and behaviors that accompany government restrictions and government decisions. And we would publish this very regularly using different visual tools. And this was very helpful in tracking the value and the impact of the different government interventions carried out during this period of time. So yeah, that's like an overview of different interventions and ways we try to mobilize communities, not only to monitor healthcare services, but to improve interventions, whether it's related to prevention of COVID, treatment, access to vaccines, etc. And this is really what we're trying to do on a regular basis. So yeah, and thank you very much for your time, and I'm looking forward to your questions or interventions.
Thank you so much, Ayman, for taking us through the presentation. Just before I open the floor to anyone else, I had a burning question in terms of the process through which you develop your interventions. So what informs the process first? Is it the research? Is it a generalized social need that you identify? Is it technology that comes up? So just if you could just walk us through. Yeah.
So in general, this is mostly done through a community need. So usually it starts with a specific community need. And then based on this, we try to detect what kind of social intervention, what kind of solution can make a difference in addressing this specific community need. And then we take it from there.
Yeah, and just a follow-up to that, who are some of your, when you're assessing the stakeholders that you're hoping to impact, or that you're hoping that the research and data that you gather from your activities, once you get all that data, who are some of the stakeholders that you target the most? Is it the communities? Is it the government? Is it other CSOs? Just for some context.
So it largely depends on the intervention. For example, when it comes to research, we were targeting government because they are the ones carrying out the different interventions, and we were focusing on giving them a different light on the value and the effectiveness of these interventions to guide further ones, for example. When it comes to something like the community monitoring tool for hospitals, here the main stakeholder is the general population using hospitals during this time. And so the idea is that this would guide their behaviors and which hospital they would visit for which need and these sort of things. So yeah, it really depends. And for each project, there is a specific set of stakeholders that we target.
Thanks a lot. I see Barak has his hand up. Go ahead, Barak.
Yeah, thanks, Martie, and thanks, Ayman, for that brilliant presentation. So, my question is, in terms of research and science within the African context, I know currently we are talking, we have a lot of talk on decolonization, especially in terms of African-based science and research. Do you have like any experience on that, on how best we can achieve this process? And then in terms of as the scientific process, the publications and all that, is there a recommendation for how best we can really harness the like the indigenous communities and indigenous scientists who probably have interventions that are really working within the communities that are in, but probably do not have that platform because of a specific, scientific process that needs to confine with the, some structures that are not really working for us. Do you have like any insights or comments into those two, which I think they're kind of related questions?
Yeah. Well, I mean, if you're devising community-led interventions that are truly from the bottom up, you won't even need to consider decolonization, because you are already devising something that is fully community-based. And I think this makes the whole difference. You are from the very beginning designing something that is that not only takes communities' needs at its core into consideration, but it's completely devised by the communities. You constantly test it, you constantly ask whether this works for them or not, and you devise your intervention from this point forward. And so it's really, you're not taking an intervention or an approach from another country and trying to assemble it in a ways that fit your context. You are really starting from the grounds up, based on the needs and based on what is being communicated from the community. And I think this makes the whole difference, because it's and we have seen in Africa a number of countries, for example, Rwanda is taking enormous steps in having community-led interventions related to the healthcare sector. And, of course, you learn from different experiences around the world. But I think in this context, what Rwanda did, and, the unique way they approach this set of interventions, I think they in themselves are sufficient to educate the rest of the world.
Thanks, Iman. I see Rasigan.
Thank you.
Yeah, I see Rasigan has his hand up. Go ahead, Rasigan.
Thanks very much, and thanks for the presentation. I really support it, and it's something we really need to be looking at expanding across our continent itself. The comments I want to make really reflect on us bringing science closer to the society itself. Yeah, and this provides an excellent way of us ensuring transparency, accountability, and even, if you don't mind, good colleagues, expanding the possibility of actually making science work for us as opposed to working on us. So I want to really push this along a line, as I think Barak had raised just now and had come up earlier in the discussion as well. If you don't mind, Simon, I would really want us to separate out these really positive ways of us ensuring that the people actually have a closer, or we reduce the distance between people and those involved in scientific and technological work itself. So I will also, through the organizers, share some work on this topic of bringing people into not only determining what science should be researching, but also having a say in the outcomes generated through the scientific process itself. Yeah. So this for me then constitutes a version of decoloniality. I'm sorry, this is going to sound a bit like semantics, but we have to separate out the praxis, what we do today, which is anti-colonial, from our removal from a colonial insertion into world systems. And here, Ayman, you see, the critical point being raised is really the gap between health and the medical system. The medical system is not about health. The medical system is an enterprise under capitalism. Its object is the generation of profits. It's an enterprise. Health, on the other hand, seeks to ensure the survival of us as a species being. There's 8.1 billion of us. Yeah, this is not a market, and very important to recognize it as such itself. So towards that end, we already have many initiatives at play on our continent itself. So I want to encourage Ayman and the colleagues from Egypt, because we have a node there for the African Science, Technology and Innovation Indicators Project. We've got very good relations with the people that are doing the work, especially the question Barak Adju had raised it. You know, what is the percentage of resources devoted towards science and technology? How much of that is towards health sciences at that level of detail? What are the outcomes? What are the publications being generated, where, etc.? And I think that brings a much more complete picture. So rather than replicating the work, it would be good to link up with the colleagues in Africa conducting this work itself and augmenting what you already have on your website or the platform itself, Ayman. I think this will really help us all, also understanding whether there is, and I'm sorry for being so long, whether there is sufficiency. What I mean by this is we have a mountain to climb, but also in terms of our exclusion. So towards that end, the percentages that people often speak about that would give us parity or equity fall short of what we require on the continent. We need to put a real number to that. What will it cost us? And then we can start measuring whether we're achieving those goals. So please excuse the political economy and rather pessimistic views, but it's important, I think, we bring all of this together. This will make science work for us on the continent. Thanks very much for the opportunity, Martie. Thank you.
Thanks a lot, Rasigan. I think on that note, just to, sorry to throw you into the deep end a bit, but I'd like to understand a bit more of how yourself in your capacity and your organization, through the lens that you look at healthcare in Africa, as opposed to the medical system itself, through your organization and through your own capacity, how have you been able to at least contribute to research? If you could just talk to us about some of the things that you've been able to do, I think we'd really gain some more perspective from that on decoloniality.
Mm-hmm. So not to push too far, but just to give colleagues an indication, quite importantly is recognizing that especially from traditional and indigenous knowledge sources, the universe, the cosmology of knowledges inside there is far greater than what the collective West's episteme offers us. That's allotropic medicine itself. And we've not utilized this huge benefit that comes from over 3/4 of humanity's knowledge commons being incorporated in how we take care of ourselves. So that's the big push, really. We have, in many examples, most of the drug discoveries, I mean, I'm sure, as you would also recognize, comes from ordinary people's knowledge of things that work. But we've not streamlined the process that allows us to capture more thoroughly, especially in all 54 countries that constitute the African Union. Yeah. So hence the link, and Martie, the organizational component responsible for collating and publishing. It comes out every 2 years. It's called the Africa Innovation Outlook. It's produced by the African Union's development agency, AUDA NAPAD. And Egypt has a very strong component within that. Not only Egypt, Tunisia's inside it, Algeria, etc. So that gives us the northern level of quantitatively what's taking place in science and technology. In Central, West, and East Africa, we also have excellent nodes, Tanzania being a very strong component, Kenya as well, but right across the region itself. And then in Southern Africa, because of the tight integration between South Africa and the frontline states, the countries closest to South Africa, we have good data about that as well. Ultimately, all of this data tells us we have huge opportunities in front of us, but our systems, because of how they linked directly to Western or transnational corporations, excludes the possibilities of us embracing these knowledges and actually making them work as well. So I really want to encourage, it is an issue of the global south, and we've got such huge benefits rather than continuing to pay rent to the transnational corporations based in the collective West. Thank you. I hope this helps us, Martie.
Yeah, thanks a lot for that, Rasigan. It's just always so interesting to hear different perspectives in their clarity and in our Africanness as well. I think, does anyone have any questions for Ayman? Ayman has another engagement shortly, and I'm sure he has to leave soon. So if anyone has any questions or comments for Ayman, now would be a great time to do that.
There's a question in the chat, Martie.
Okay. Yes, question from Nelda. I'll just it's a whole paragraph. But I'll just pinpoint what Nelda is asking. My question is, what role do you think us as university students can play to help Africa in terms of advancing the role of technology in the health space around Africa? That's the first question. So around how the university students can help to play the role. And the second question is, I have seen a lot of campaigns fighting for dropping intellectual property rights. Do you think this will just suppress innovation, especially now scientists do not have the motivation to create the technologies? Also, dropping intellectual property, don't you think this will work against Africa, since they know they will just get the technology from those that have developed it? This is to Ayman and Rasigan, so feel free to go ahead. We can start with Ayman.
Sure. So actually, during my medical school years, I was part of a medical student organization, and my work in this sector really started as a medical student, so as a university student. And so I can tell you there's a lot to be done as university students. And the reason behind this is that the use of technology and the capacity to really pinpoint the problems that are regularly facing the healthcare sector, I think students are best equipped to that. And I think really it's the biggest loss, and it would be the absolute biggest shame if the students don't have the space to have these interventions. Now, what kind of role can students have in this regard? Well, first of all, they are best fitted to innovate. They are best fitted to interact with their communities. They are the most capable of bridging the gap, really, between what technology can do and what society needs. And I think in this regard, communities are more and more leaning towards listening to what students have to say. And I think it really makes a difference in this perspective. I don't know if this answers your question or not.
Yeah, so Nelda indicated that she can't speak at the moment. But Rasigan, I've seen you've posted something in the chat. Do you have some time to just elaborate a bit about your answer?
Yeah, so also, I very much support what Ayman has raised. I also want to encourage, as we engage in teaching and learning, so in other words, when we are in the classroom itself, it's also, a huge responsibility upon us to question the theoretical and axioms that are being shared with us. And so through this, we can also then unpack the conditions that are negative to us and try to push forward on research that actually seeks to solve our problems itself. I really want to encourage that. Without that, society will stagnate as well. And we need intergenerational challenging of these assumptions because they seriously constrain us. And that's why I used as the example most practical, and it fits with your introduction to this forum itself. Yeah. The countries, India and South Africa, had proposed to the World Trade Organization a waiver on intellectual property restrictions during the pandemic. Now, you know, we are 1.5 months since the World Health Organization has said it's no longer a global pandemic. But you'd be, I'm sure, not surprised that the World Trade Organization is still debating whether a waiver is necessary. So I hope you get a sense through that these things which we socially determine should be open to being changed based on an assessment of where we are at any given point. It cannot be that rhetoric basically advances seeking profits rather than saving lives. And that's the clearest example. Global vaccine apartheid has shown us the rigidities of the thinking process, whereas we have huge opportunities in science and technology to fix problems, should we choose to embrace it. We should not be locked into these things that we've inherited from the past. As you know, those inheritances weren't for our advantage. They are essentially what has allowed the collective West to hold a hegemonic position in the political economy at present. Thank you.
Thanks a lot, Ayman, for your presentation. Feel free to drop off at any point. I wouldn't want to keep you any longer than is necessary. So at any point, if you're ready, feel free to drop off.
Thank you very much. Thank you very much for the very insightful discussion and the very yeah. I mean, I really appreciate being there and this incredible feedback. Thank you.
So I see Nelda has posted another question, or rather more comment. And since Ayman has just dropped off, and anyone can feel free to take this on, but I have a feeling it's directed at Rasigan once again. So Nelda says, thank you, very insightful. So a rather funny question. What do you think have been the effects of restricting IP rights on Africa? And just as we think about this, I'd also like to pose a bit more of a nuanced question in the sense of we've seen Moderna setting up a $500 million facility, or at least are in the process of setting up this facility in Kenya. We've seen that BioNTech are preparing to start the vaccine production in Rwanda as well. We have mRNA hubs across the continent as well. In that sense, knowing that we just went through COVID since 2020 and how the whole world, especially the global north, was saying that this pandemic would finish Africa, is it a good sign that these big pharma are setting up now in Africa, or are there measures we need to put in place in terms of making sure that it's not just a cheaper option and a cheaper way of monopolizing the pharmaceutical industries in Africa? So even as we think about decolonization, what are the impending impact of having this big pharma setting up in Africa? I see Barak has his hand up.
Yeah, thanks, Martie. Loving the discussion in terms of science. So just drawing us back as I dig into transition into the question you have asked in terms of the IPs and all. Yes, I agree. The WHO declared that COVID-19 is no longer a public health emergency, but then our push for IP, Aziz, we are not really calling for the dropping of the IP rights, but we are really pushing for the waivers at the time when we, especially the African continent and related areas, really needed to upscale or produce the vaccines, the medicines and all in, like in bulk quantities to support the continent. So at the time, it was not that it was really working against us, but it is literally to work for us, because once this are waived, and then let me just transition towards Martie. Yes, we know all these pharmaceuticals setting base and all that, but these are the same pharmaceuticals that are really holding back to that information. So for me, I'd say it could be probably an extension of colonization, because I'm coming to set up a company in your land, but then I'm not really empowering or giving the community, the government in place, the research, the scientists available, that knowledge, so that they can with them transition it to themselves. Because once they decide Pfizer or Moderna no longer wants to work in Kenya or in Rwanda or in Uganda, then they will close ship and go away. They will go away with all the technology, with all that is set up there. So that is why we've really vouched for the mRNA hub, so that all these intellectual property are housed in one place. We can build on that technology, on those skills and knowledge, even to innovate on other interventions that will come in. We still have Ebola is still causing challenges. TB is still a problem. HIV/AIDS is still, issues that need to be addressed. We have, the different bits that need vaccines, that need medicines, and all that. So the only way that we could say, yes, let's let Moderna set shop is, are they going to transfer that technology? What is the percentage share of the ownership, the workers in that place? What is the content of those specific contracts, the legal entities? Who is in charge? Who is funding? Who is receiving? Those specific nitty-gritties in terms of contractual obligations, even with the host government. At the end of the day, when those medical products come out, who is really responsible? Because it could be this is a place for even cheaper production, so that then even it maximizes their profits further. So once this is done, then, all the proceeds, all the exports still go to the West. So we need also to ensure at the end of the day, who is the end users of these products. So for me, that I think will be the best way forward. But we still lobby for the issue of IP waivers. We still need this technology. Like we said, there is that bit of medicine and there is the bit of health. So we still need to push for the IP rights in order to take care of our health, take care of our future. And as we speak into pandemic preparedness, deliberate laws that are existing, not only at the time when we have that emergency, but even before. So that emergency that just finds us already prepared, like this is happening, we start executing straight away. Because when it doesn't happen, then a pandemic comes in, then by the time we come up and start changing these laws and the focus again, 3 months, 4 months down in the line, people are already dying out of it. So it is better when it starts, we know, okay, this is it, and we start executing the protocols as needed. Those are just my 2 cents. Thank you.
Lord Barak, I don't know if Nelda, that answers your question, or Rasigan, do you have something to weigh in on, or have you expressed yourself sufficiently?
Maybe just to just keep adding on the lines that I think we're developing itself. What's quite critical in this is intellectual property is something that offers us a possibility of earning. But for us to be earning, we need to be alive. So I think it's quite important also. And for me, the biggest lesson that the whole COVID-19 pandemic taught us is we can't expect anyone else to come and save us. We are on our own. And I mean this continentally, and as Africa and as Africans, we've learned this continuously. So it still shocks me that we have our political class running around with begging bowls, expecting someone to come and save our lives, when all our history has taught us the opposite. So in terms of preparing for it, at least we must use what's now being declared as public policy in Africa. That commitment from the African heads of state, including specifically ministers responsible for science, that we will take 1% of our individual gross domestic product and invest in R&D. I'm sure Barak, I'm sure Anton, all of us will agree. It wasn't a miracle that gave us the vaccines. It was because of long-term investments in scientific capabilities, capacities, and competences that allowed it. Already we are seeing warnings. It's not just avian flu, a whole range of other possible pandemics at our doorstep. But I'm sorry, colleagues, when we look at what we've done since the pandemic, we don't have, notwithstanding promises, we don't have our own vaccine production facility. There's one in South Africa that has said they are not going to continue producing the vaccines because the governments are not buying them. So you see, this wider ecology needs a better appreciation from ourselves. It cannot be that we then expect people to invest, whereas we don't buy the products that come from it. A lot needs to be done. But I hope through this, we also see health cannot be isolated from the wider political economy, and especially our push towards industrializing our continent. Without industrialization, we remain at the fate of nature in that way. So thank you very much, colleagues, and best wishes for all of us.
Thanks a lot, Rasigan and Barak, for your contributions. So our second guest had an emergency meeting and was not able to make it. It was supposed to be Zambia's GCAP lead, but they said we'll have to figure out how to get them around next time. So, but this has been a really enriching discussion. Before we close off, Christine had mentioned something about the healthcare situation in Kakamega. Christine, do you mind just briefing us on what happened on Wednesday in Kakamega and what the implications are, at least for the health in terms of the county? Welcome, Christine.
Thank you so much. Good evening. We were able to launch the Facility Improvement Fund. What happens in Kenya, people have enrolled for National Health Insurance Fund, and we also have the Linda Mama program, whereby women, when they go to deliver, they deliver free, and then the government gives some money through that support. So what used to happen initially is this money, when it comes to government, it comes as a source of revenue. Instead of it being plowed back to health facilities, it goes for political mileage like roads. So we were able, as civil societies in our county, we mobilized ourselves. After doing the social audit, it's when we partnered with the decision makers, we came up with that policy. And it's now a plus, since now this money will not be going back to the revenue. It will be just be plowed back to the health facilities. And I'm sure we'll be able to improve our health system strengthenings in our health facilities. The gaps that were there, issues to do with stockouts, staffing, at least they'll be able to be addressed at this point. Thank you so much.
Christine, just a slight question. Please clarify, what do you mean that in the sense that it used to come as revenue? What has the change then been? Sorry, I didn't quite catch that.
Okay, what happens when this money comes? It comes to we have a revenue account in the county government. So it goes to the revenue account. So instead of this money being plowed back to the health facilities, instead now the governor will decide to take it to roads, something that will give him political mileage. So right now, when we came with this fund now, health facilities initially used to have their own bank accounts before devolution, whereby government will just transfer money to the health facilities. So right now with this bill, what happens now is this money now won't be going as a source of revenue in the revenue account. It will just be going direct to the health facility to enable it now meet their needs at the source point. Thank you so much.
Right, okay, great. That sounds like potentially, if used well, it would actually benefit the county residents, and hopefully we can have other counties throughout the country of Kenya adopting that same mechanism. So members, it's 3 minutes past the hour. Unless anyone has any questions or comments, this has brought us to the end of our session today. I just want to thank everyone for making the time to join us. It's always so great to have your company and to have your thoughts and your experiences, and to just talk about the healthcare situation around our continent. So unless anyone has any questions or comments, Nelda, thanks a lot for your contributions as well. It's always good to share ideas. It's not necessarily about convincing anyone. It's more so about just knowing where someone else is coming from and what our perspectives are and what the impact of those perspectives is based on the work that we do in our respective organizations. So yes, this is always a welcoming space. Thanks, Gerald, Andrew, Nelda, Yuba, who joined a bit late. You missed our presentation, but we have the recording available. We'll also have meeting notes sent next week, just so that you can catch up and see how we address the issue of science, technology, and research and its relation to impact on the continent. So in case there are no more questions, thanks everyone. Have a great week ahead.
Thanks, Martie. Have a great one too. Bye, everyone.
Bye.
Thank you. Bye.
Bye.
Thank you, Habati. Have a nice day.
Thank you. Have a good evening. Bye.
Bye, Christine.